Assalamu alaikum. I am Dr. Abdul-Aziz Youssef. Welcome to the second lecture on our hospital policies and procedures for peer review. We will examine key aspects of the policies through practical case-based scenario. Question number 1. A physician at a hospital has been identified for an internal peer review due to an unusual pattern in their clinical care. This pattern was noticed during routine administrative meeting. B. A standard patient satisfaction survey. C. Quality review of various cases. D. Annual general assessment of all staff. The correct answer is C. Internal peer review is typically initiated when a specific pattern, care, or incidents are identified during quality reviews of various. This process is focused on evaluating and improving the care provided by individual practitioners within the hospital's medical staff. Question number 2. A surgeon's approach to special surgical procedure has prompted an internal peer review. This review was most likely triggered by A. Formal complaint by a patient. B. Identification of a sentinel event during a retrospective review. C. Regular staff rotation. D. A routine update of surgical protocol. The correct answer is B. Internal peer review can be triggered by the identification of sentinel events or unusual cases during retrospective review. This process helps in closely monitoring the practices of individual practitioners and ensures adherence to high standards. Next question. During a peer review process, a reviewing physician realizes they had previously worked closely with the practitioner under review. In this situation, the reviewing physician should A. Continue with the review but maintain objectivity. B. Notify the peer review committee about a potential conflict of interest. C. Review the case anonymously. D. Only review parts of the case not related to their prior collaboration. The correct answer is B. In the peer review process, any potential conflict of interest, such as prior working relationship with the practitioner under review, should be disclosed to the peer review committee. This ensures the integrity and impartiality of the review process. Next question. A member of the peer review committee is assigned to review a case involving a colleague with whom they have a competitive professional relationship. The appropriate action is to A. Decline the review assignment. B. Proceed with the review but avoid bias. C. Consult with another committee member before proceeding. D. Discuss the potential conflict with the committee chair. The correct answer is D. In situations where there is competitive relationship with the practitioner under review, discussing the potential conflict with the committee chair is crucial. This allows the committee to assess and decide on the best course of action to maintain an unbiased review process. Next question. A hospital's medical executive committee decides to seek an external peer review for a complex case involving new technology. This decision is most likely based on A. The novelty of the technology and the lack of internal expertise. B. The routine procedure for all new technologies. C. A general policy for all complex cases. D. The request of physician involved in the case. The correct answer is A. External peer review is often sought in cases involving new technology or procedures where the hospital's medical staff lacks the required expertise. This ensures an objective and expert assessment of the care provided. Next question. When facing ambiguous recommendations from internal reviews regarding a specific medical case, the hospital opts for A. Additional internal discussions. B. An external peer review. C. Consulting with the hospital administration. D. Revising internal review protocol. The correct answer is B. In cases of ambiguous or conflicting internal review recommendations, an external peer review can provide clarity and expert opinion, helping in making informed decisions about patient care and practitioner performance. Next question. In the peer review process at a hospital, who among the following is most likely to sign a confidentiality statement before participating in review activities? A. All hospital employees. B. Members of the peer review committee. C. Patients whose cases are being reviewed. D. External consult. The correct answer is B. Members of the peer review committee are typically required to sign a confidentiality statement as part of their commitment to maintain the privacy and integrity of the review process. Next and last question. Who among the following wouldn't usually have direct access to a practitioner's quality file during the peer review process? A. Medical staff president. B. Hospital risk manager. C. A fellow practitioner not involved in the review process. D. The director of quality management. The correct answer is C. Access to practitioners' quality file is limited to authorized individuals directly involved in the peer review process. A fellow practitioner not involved in the process would typically not have access to this confidential information. Thank you for joining us. Stay tuned for more policy review.